Welcome to the podcast. My name is Dr. Noor Gajraj. Let's talk about understanding depression, shedding light on a global challenge. Depressive disorder, commonly known as depression, is a mood disorder characterized by a persistently depressed mood or loss of pleasure or interest in activities for long periods of time. The Diagnostic and Statistical Manual of Mental Disorders, 5th edition, or DSM-5, typically defines major depressive disorder, MDD, as at least 2 weeks of pervasive low mood, low self-esteem, and loss of interest. It's crucial to distinguish clinical depression from normal sadness or grief. While everyone experiences periods of feeling down, depression involves persistent, debilitating sadness that significantly interferes with daily life, relationships, and work. It is a real illness, not a sign of weakness or something one can simply snap out of. The global impact, prevalence of depression. Globally, an estimated 5% of adults suffer from depression, accounting for approximately 280 million people worldwide. In the United States, roughly 1 in 6 people will experiencing major depressive episode at some point in their lifetime, and about 16 million adults suffer from clinical depression each year. The prevalence of anxiety and depressive disorders saw a significant increase in 2020, with initial estimates showing a 26% and 28% rise, respectively, largely due to the COVID-19 pandemic. Women are more likely to be affected by depression than men. These numbers highlight the immense burden depression places on individuals and healthcare systems globally. Risk factors, the complex web, part one, biological and genetic. Brain chemistry, disruptions in neurotransmitters like serotonin, dopamine, and norepinephrine, which regulate mood, sleep, and appetite, are thought to play a significant role. Hormones, changes in the body's hormone balance, such as those during pregnancy, postpartum, menopause, or related to thyroid problems, can trigger or exacerbate depression. Inherited traits. Depression is more common in individuals whose blood relatives also have the condition, suggesting a genetic predisposition. Researchers are actively trying to identify the specific genes involved. Biological differences. People with depression may show physical changes in brain structure or function, though the precise significance of these changes is still being researched. Part two, psychosocial and environmental factors. Socially stressful and traumatic life events. Experiences like unemployment, bereavement, traumatic events such as abuse or accidents, or severe losses are strong risk factors. Chronic stress and adverse childhood experiences. Continuous exposure to violence, neglect, abuse, or poverty. Limited access to resources. Inadequate access to food, housing, healthcare, and other essential resources. Lack of social support. Social isolation and loneliness are strongly associated with increased depression risk. Personality traits. Individuals with low self-esteem who are easily overwhelmed by stress or who tend to be pessimistic may be more susceptible. And substance use. Alcohol and illicit drugs make depression worse. Recognizing the signs, emotional and cognitive symptoms, persistent depressed mood, feeling persistently sad, down, or empty for most of the day, nearly every day. Loss of pleasure or interest, anhedonia, a markedly diminished interest or pleasure in almost all activities once enjoyed. Feelings of worthlessness or excessive guilt, fixating on past failures, self-blame, or feeling undeserving. hopelessness about the future, a pervasive feeling that things will never get better, poor concentration or difficulty making decisions, finding it hard to focus, remember things, or make even simple choices. Thoughts about dying or suicide, ranging from passive ideation to specific plans, and are always a serious warning sign that requires immediate action. Physical and behavioral symptoms, tiredness and lack of energy. Even small tasks can feel like an immense effort. This is one of the most common physical symptoms. Disrupted sleep patterns, insomnia or hypersomnia, changes in appetite or weight, significant unplanned weight loss or gain due to decreased or increased appetite. Anxiety, agitation, or restlessness, feeling keyed up, restless, or unable to sit still. Slowed thinking, speaking, or body movements, observable by others. Aches and pains, unexplained physical pain, headaches, or digestive problems. Social withdrawal, often wanting to stay home rather than socialize or engage in new activities. Treatment approaches, pathways to recovery, lifestyle changes. These are foundational and highly impactful. Regular exercise helps create positive feelings, improves mood, and can reduce symptoms. Quality sleep, establishing healthy sleep habits. Healthy, balanced diet, eating nutritious foods and avoiding excessive alcohol, which is a depressant, or illicit drugs. Stress management techniques like mindfulness, meditation, and relaxation. Staying connected, maintaining social ties with friends and family. Talking therapies, cognitive behavioral therapy, teaches skills to identify and manage negative thought patterns and improve coping behaviors. Interpersonal therapy focuses on improving relationships and social roles. Medications, antidepressants can be very effective in alleviating depressive symptoms by balancing brain chemistry. Often recommended for moderate to severe depression, sometimes in combination with therapy. In conclusion, depression is a common, serious, and treatable illness. It is not a sign of weakness, and those experience it are not alone. With proper diagnosis and treatment, the vast majority of people can and do recover. Well, thank you for listening. Please consider buying my book, 100 Pathways to Longevity, and subscribing to this channel.